The 2014 Signature Health Policy Forum featured keynote speaker Joe Flower, CEO of the Change Project and author of Healthcare Beyond Reform, Doing It Right for Half the Cost, and A Handbook for the Revolutionary, Changing Healthcare Overnight. Following the keynote presentation was a Reactor panel discussion featuring healthcare leaders from across the nation. The following are excerpts from the panelists' opening statements and their discussion.
We have to fix this because we have to. This is more than just a healthcare issue. This is our economy. So not a lot of disagreement with the numbers that Joe put out there. Maybe just a few, but really, the concept is all the same. This is a third of our economy. This could bankrupt our country. So we do have to find different ways and find new ways to finance this, align provider incentives, and understand our roles. So the last point I'll make as I close here to hopefully spark some conversation is our roles. So the roles that we play are multiple, and what's going to happen over the years to come is our roles are going to morph. They're going to change. We're going to be friends. We're going to be frenemies. We're going to be collaborators.
We have a number of initiatives that we're looking at. Joe mentioned many of them that we are considering. We've opened a clinic as a pilot in one of the state office buildings to see if that will help lower some of our costs. So with our partners like Coventry, like UMR, like ESI Express Scripts, we are trying to do our best to manage the tax dollars that you are providing us to provide these benefits. So it is going to be a very interesting time for us, and for what will it take from a member's perspective to change behavior.
4 years ago, our senior leadership team embarked upon a strategic planning endeavor asking, where do we need to be in 10 years? One of our first conclusions was that the healthcare system as currently designed is broken and unsustainable. Now that strategic direction statement led us to make a number of decisions over the last 4 years. First and foremost, we decided that this healthcare transformation would not be hospital-centric. Hospitals will no longer be the center of the healthcare universe. That physicians are going to have to assume more and more leadership roles within any healthcare system. Physicians will be the front door of a healthcare system in the future. Patients tend to relate to their physicians much more so than they relate to their hospitals.
As an employer, we have finite money, and I think we're challenging the carriers, our administrators, the hospitals, the providers, that we have no more money. We are challenging them to come up with solutions that force some of the market change, in that there is no more double-digit increases that we can afford as the employer group. Those days have long gone, and I think it's just becoming more and more evident to us that there are still much more opportunity in the market for reduction in costs with equivalent quality of care, or even better quality of care.
And it's going to be a generation, in my opinion. We talked about technology, and it's great. It looks great on TV. Does it really work? And where we're at, I'm not going to say in the infancy, but we're starting to crawl with that. It's not perfect, but there are a whole lot of things that could happen that will reduce the cost curve and reduce the demand curve, at least on site. So if you think about years and years ago, doctors used to make house calls. Well, we're kind of going back to that, except the house calls are going to be on your smartphone.
I was fortunate enough to visit a healthcare system in Sweden a couple of years ago. Very different system, but one of the things that they had identified is that they wanted to move from a medical model to a social medical model, because so many of the situations that happen in healthcare are driven by social needs. We are seeing today in hospitals, somebody mentioned earlier, patient is perfectly able to be discharged but has no transportation, no caregivers, no something else in the home, it becomes a social issue, not a medical issue. And hospitals are now putting together social issue units, some place to put a patient for a short period of time until some of those social issues can be addressed. So I absolutely agree. There are so many other issues that fall outside the traditional box of a healthcare model, the medical model, and we are going to need to find ways to partner with others to help address that and bring that into the broader system. We have to redefine the boundaries of the system in the future.
The increasingly important conversation of healthcare reform will continue at the 2015 Signature Health Policy Forum. Please join our discussion by attending the 13th Annual Forum, Fall 2015.